I want to tell y'all about a case that I had recently in the ER that is very interesting to me, but it might be terrifying for a certain demographic of people. So if you're the kind of person who thinks that you have every disease that you hear about on the internet, maybe keep scrolling because this might not be for you. But if you like hearing about rare and interesting cases, listen up. It used to be that it was very rare for people under the age of 40 to have a heart attack. And still to this day, some doctors will hear that a person having chest pain is under the age of 40 and just say, okay, well, let's just get an EKG and send them home. Don't do that, guys. Don't do that, because the recent data shows that about 1 in 5 heart attacks is actually now occurring in people under the age of 40. Now, this case isn't as straightforward as a simple heart attack. It's much more complicated than that. But there is a possibility that the cardiologist could have blown off his symptoms when I called them based on the patient's age, because this patient was in his late 30s. And I'm just glad that the cardiologist actually listened and did something, because it saved the patient's life. So a guy in his late 30s comes into the ER with chest pain. Healthy guy, no past medical history. He is a cigarette smoker. That's a risk factor for heart attacks. This is your PSA to try to quit smoking if you can. But this guy was previously healthy, was working out every day at the gym, comes into the ER saying that his chest is hurting. We get an EKG on him, and it shows us what we call an inferior STEMI, which means that we're concerned that he's got a blockage in his heart in the artery called the right coronary artery. So I call the cardiologist and tell him what's going on. Rightfully, his first question is, did you ask the patient if he uses powdered sugar? Because if you don't know, using powdered sugar can give you chest pain and also make changes on your EKG that can look like a heart attack. But I told him, I asked the patient if he uses powdered sugar, and he said no. The only substance that he uses is tobacco. So the cardiologist said, it's probably not real. He's really young, he's healthy, probably not a heart attack, but send me the EKG, I'll take a look at it. I sent him the EKG while he's on the phone with me. He said, oh crap, yeah, no, that's an inferior STEMI, activate the cath lab. So we treat the patient with a blood thinner called heparin. We send him to the cath lab where they were going to try to open up this blockage in his heart. A few hours later, the cardiologist calls back. They never call us back. And he said, I got to tell you what happened with that patient. For anybody that doesn't know much about the heart, this is what the heart looks like. It has these blood vessels on the outside that we call the coronary arteries. And when you have a heart attack, these are the arteries that we're talking about being blocked. You got your left main up here, your left circumflex, you got your left anterior descending. On this side, you have one that's called your right coronary artery. And that's the one that we're talking about whenever we talk about an inferior STEMI. This is the one that we're worried about being blocked. So in the cath lab, the cardiologist checked all of those arteries on this patient. All the other ones that were on this side looked fine. Then he got over to the right coronary and he found a surprise. This patient had something called a coronary artery aneurysm. So instead of being pretty and thin blood vessels like they are right here, his coronary had a big old balloon in it. It was dilated really big. So it was coming up from the base, and then all of a sudden got to be a big, huge balloon, something that we call an aneurysm. And inside of that aneurysm, the patient had a blockage, a blood clot, something that we call a thrombus, a big collection of dry blood that was blocking up that artery. And that's what was causing the heart attack, or what looked like the heart attack. And the cardiologist is telling me that this aneurysm had probably been there since the patient was very young, or maybe even since he was born, and probably growing over time. And when aneurysms grow like that, it gets to the point where they get too big or the blood pressure gets too high, they can rupture. And that can cause sudden cardiac death. So it's possible that that blood clot inside of the artery, that heart attack, is what saved the patient's life. Now this is where the case gets really crazy. So the cardiologist tried to open up that blockage, get rid of the heart attack. They couldn't do it. So they had to call in the interventional radiologist, who came in and tried to use a device called a penumbra to try to pull that blood clot out of the artery. They couldn't get it out, and when they were trying to get it out, that artery dissected. And what that means is the wall of the artery kind of split in half, and blood started leaking into the wall of the artery. And that can be really dangerous, because that can go all the way back to the aorta, the biggest blood vessel in the body, and cause an aortic dissection, which is an extremely dangerous condition. So then they had to call in a cardiothoracic surgeon to come in and do emergency open heart surgery on this patient, something that we call a CABG, or a coronary artery bypass graft, where they had to take a blood vessel from another part of his body and replace that blood vessel on his heart that had dissected. And it had gotten all the way almost back to the aortic root, the scary part, and they had to do some repair of that as well. So this was a young, healthy patient who suddenly developed a critical condition requiring multiple specialists to come in and do emergency procedures to try to save his life. and 2 days later the patient was extubated in the ICU and was up walking around doing really well. So do not ignore your symptoms. You are not too young and healthy to be sick. Providers, do not write people off because of their age. This is a very rare condition. The cardiologist that I was working with had been in practice for more than 20 years, and this is the first time he'd ever seen it. But it happened.